Hi everyone, I hope you're doing well. Welcome to Spill the Beans. My name's Duncan Goldie. My guest this week is Dan Pelino, who joins us over from America. Dan is the founder of Everyone Matters, which is a social impact enterprise dedicated to ensuring that everyone has equal access to citizens-based services, healthcare and education. He's a regular contributor to the discussion on healthcare, citizen-based services. He's been on CNN, Bloomberg, the BBC, loads of other media outlets. He worked for IBM for 36 years, leading its global healthcare and life sciences business for 10 years. And recently, he's put all of the findings that he's got throughout his career down into a book called Trusted Healers. And it basically takes the reader on the journey of the future of healthcare and how basically it's all up to the individual to choose your trusted healer, which Dan goes into in a lot more detail. It's a really interesting insight, and he's very, very experienced in this area. So really great to get someone who's been on Dr. Oz and quite a lot of high profile platforms onto our little podcast. But I hope you guys enjoy it and take it away. Okay, Dan, thank you so much for taking the time to feature on the Spill the Beans Digital Health podcast. It's nice to have you here. You're probably our most well-versed guest at doing these podcasts, because I know that you've been doing a fair few of them recently. But tell me, whereabouts in the world are you right now?
Yeah, it's wonderful to be with you, and thank you for inviting me. I'm looking forward to our conversation. So today I'm coming to you from in Rehoboth Beach, Delaware. So it's on the Atlantic Ocean. So I could maybe look across and see you across the pond here. But I'm right on the Atlantic Ocean, which could be an interesting place because it is the summer home of Joe Biden, who, as you know, is running for president of the United States. Yeah. So it's just a sleepy little town, 2,500 doors, just right on the ocean, on the Atlantic Ocean. And so we're here with our dog, and we're kind of hunkered down while, like everybody else, and doing a lot of podcasts and talking to people like you.
Well, it's a good way to pass the time. What's the kind of COVID situation like? Is everyone like pretty much self-isolating over there at the moment, or?
Well, there's a lot of aspects to that. I do think most people, at least around here, are wearing masks, which are good, and I think people do try and social distance. But, just like where you're from, people want to go to football games, soccer, and people want to go to football games, American football here. So they're all itching to get into crowded situations, which have proven not to be good. Yeah. And as the school-aged children and people going back to university have gone back, it's caused this spread. And right now, the people that follow this are asking people to pay very close attention, at least for the next month, including Thanksgiving, to try and keep people away from large groups and wearing masks, social distancing, washing their hands, and doing the things that we should have been doing all along.
Yeah, exactly. It's a bit of a wake-up call, isn't it? But perfect. Well, thank you very much for agreeing to be on the podcast. It's really interesting. So you've written a book recently, Trusted Healers, which is selling very, very well. I think it's sold out actually over here. But talk me through kind of the kind of earlier stages of your career before we get onto the book. What kind of, led you up through your career to think, I want to put this all down and talk in a little bit more detail about it all?
Yeah, thanks for that. So I worked for IBM for 36 years, and most people are familiar with IBM as a company. And IBM likes grand challenges and to do things that put a man on the moon, et cetera. And along my career, I'm a behavioral science person. I'm not necessarily the lead technical person, but I'm an individual that you ask to look in gaps to create revenue and create value and find new ways to approach markets. And so it was in the 2000 period of time that then Sam Palmisano, the chairman of IBM, came to me and said, we want to think about healthcare differently. And you being a behavioral science guy, could you think about this as opposed to the traditional ways that we looked at it before? You see, most people thought about healthcare as a hospital or a doctor. They thought of an insurance company as an insurance company. They thought about pharma really almost like a distribution company, distributing medications, pills, et cetera. but no one had really thought about it coming together, concentric circles with the patient in the middle, patient-centered care. And so that's what I worked on with some of the leaders from around the world to start to build out this idea of what would be the role of the entry point of healthcare, the GP, the RN, the PA, as opposed to we were leaving so much of the challenge at the doorstep of the emergency room. And we weren't doing a good job, with some exceptions. Certain countries were better than others, but around well care. How do we get in front of sick care? How do we try and help our citizens be able to be healthy in literally what is the race of their life?
Yeah, absolutely. I mean, it sounds like such a, I mean, you're not wrong about IBM wanting to take on big problems, right? That sounds, it's like, where do you start? So, I mean, in terms of, I suppose, throughout your time at IBM, what were the kind of main findings that you had? I mean, I know that there's a lot of this in the book, but what were the main kind of findings about, the differences between different healthcare economies and the importance they were putting on, I suppose, their patients' access to care from the earlier stages, much before this kind of new age of digital innovation?
Well, for sure, when you looked at the best performing healthcare systems in the world, you found that those countries spent more money on primary care, on the front door of care. So the best performing countries such as Denmark, Sweden, others, they spend 14 to 20% of the first dollar, if you will, or first euro on the idea of preventative care, primary care. The US market is well behind that. They were 5%, 5 to 7% in that market. So that gives you kind of the idea of the bookends, the best performing systems and countries that delivered care, regardless how you paid for it, regardless if it was a country owned, state owned, however it was paid out, private insurance. The focus on primary care and the front door of care versus the back door of care, like the emergency room, is profound for all of us. Is profound for all of us. And so that's why I wanted to write the book, is because it's so important for us as patients, as consumers, to understand what we need to do to understand our numbers, our glucose levels, our BMI, to be able to make sure we have our flu shots, to know and have a primary care doctor, a trusted healer, if you will, that helps us. I'm reminded of an analogy that I think is really appropriate for us. And that is, for many years growing up, we all had a doctor or someone that we might have known that was in our family. And we would go in for an appointment and get our shots or whatever we would do. And then we would leave. And then we went into an environment where we would go into a hospital situation or go visit a doctor, and there would be a knock on the door. The doctor would come in, we'd see the doctor. And after 15 minutes, oftentimes they'd give us a prescription to be filled, and then they would leave. And then the chances of us seeing that doctor again were relatively low. So sort of like someone rode into town on a horse, if you will, stopped by to see us, and then they left on that horse, and then we were still there. What we really want is we want to be able to have a team. So if I can paint this picture for your listeners, we are in the race of our life. We're a Formula One car. And what we want is a pit crew of specialists and GPs, RNs, PAs, others that help us. And they're wearing our colors. They're wearing the colors of our car. And they're able to tell us, come in, now is the time to get your annual physical. You need to come in and do your mammogram. You need to come in and do your colonoscopy. And they tell you, got to change the tires and then get us back on to the racetrack for the race of our life. And that analogy of us being a race car and wanting to be as tuned as best as possible and perform as best as possible, we really need team care models. And that idea of the continuum of care, a trusted healer, is not an individual, but it's more of a system. It's a system that knows us, that we can reach to, that we can talk to, and we can come in and have a pit stop and then quickly get back onto the race of our life, like a Formula One car that's driven off of one of your great companies, McLaren, and back and get that checkered flag and do the things that we want to do in our society for our families and for us as individuals.
Yeah, absolutely. I mean, do you think that starts around with the individual around, educating themselves more on, their accessibility to healthcare and what they should be doing, or do you think that comes down to more kind of governmental and system level decisioning that needs to happen about, these are just the pathways that we provide to healthcare, which enables people to have much better access, which is kind of something that we're seeing at the moment.
Well, it's a little bit of both, but for sure, what we've learned is that we need to do a better job as individuals and with our families around healthcare literacy. So when should you go see a doctor? Do you go in for your annual physical? Now with telehealth and being able to, when should we ring the doctor and have that conversation? Also on mental and behavioral health. My good friend Patrick Kennedy wrote the foreword to the book on mental. He's one great leader in the world of mental and behavioral health. And certainly the Kennedy family's been a great fan of the UK and with great relationships over time. That idea of checkup from the neck up, of being able to have the complete checkup. It's not just a physical checkup, it's also mental and behavioral health. And within your markets, Dr. Kingsland, who is your radio voice, your medical radio voice, your primary care radio voice for the BBC, he's been a huge proponent. As a matter of fact, I write about Dr. Kingsland. I write about Jeremy Hunt, who has done a wonderful job in the time that he was in office and continuing to go forward with the role of the GP, how important that is to have the GPs be not only respected, utilized, but an important part of families. So I do think it's two aspects. It's first that health literacy, so we know what we're looking for, and then get into the systems. Where does health meet the consumer? What does that look like? Being able to ensure that you have a primary care doctor and a system assigned to individuals, and then having that system call their patients within their managed service area, within the catchment area, however you define it. But patients that are part of that practice, is someone calling them and saying, it's time for you to come in and get your physical. It's time for you to do this. Back to the analogy that you have a pit crew that is working with you.
Yeah, absolutely. Perfect. So, I mean, the book seems to cover quite a few different aspects of, healthcare and I suppose the overall healthcare economy. Are you able to talk us through a little bit more of a kind of synopsis over the whole healthcare, over the book and kind of what the different components are?
Yeah, absolutely. So what I really wanted to set out to do was I was really fortunate and worked with great teams and great leaders and had a chance to see some of the best minds in the world on healthcare. So I definitely wanted to think about leadership with the strong tenet being healthcare, and then also societal change. And I was not planning to write a book. When I retired, I was encouraged by many of the clients and individuals I'd come to know and others to say, Dan, you've seen the best performing systems. You've worked with these great leaders. You should write a book because it'll give patients insight into things that they should do. And that's what's in the book. There's literally pages you can tear out and take to your doctor and ask questions about, am I in a medical home? Is this helping me? What should I do about these metrics, et cetera? So it becomes a great guide. But along the way, we learned a couple of things on leadership, these great leaders. And I would put Dr. Kingsland certainly there and Jeremy Hunt. They started by asking questions. They didn't start with an answer. And I think we all recognize that in great leaders. If a leader starts with the answer before they ask the question, you kind of wonder whether or not they're answering the right question. And what we found in healthcare from these wonderful leaders, Nelson Mandela and others that we work with, and people that really influence these markets on all fronts around the world. They all, when I met with them, they all started with a question. They all had a view of trying to make something better. And that's where they started. And then we looked at societal change. And this was the biggest awakening, if you will. And that was that in the Bible, they reference 40 years, 146 times. And the reason is they reference it as a generation. And that's what we found is that it takes generations to change healthcare. Many of your listeners may remember that they had an individual in the family, maybe an aunt or grandparent or somebody that was a matriarch within the. You may go to a doctor, but when you came back, they said, no, we're going to lather you up with this, and you have to have this chicken soup or whatever it is. I have the right pathway for you, whatever the doctor had to say. There were individuals, that tried to be that trusted healer. And it's been over time that we've gotten into these trusted relationships with doctors and others that have replaced and taken over for, maybe there was a family member that might still be there, but the back door now. And one of the challenges we have, of course, now is with all of the search engines. Do we as individuals, do we start to go out and ask ourselves, what's my problem? Do we self-diagnose? Do we then self-prescribe? Do we self-medicate? And therein lies a significant challenge, because if we start taking on that kind of responsibility without the advice and counsel of someone in the medical field, we stand the risk of complicating our conditions more. And that's why you need to have a trusted healer. You have to have a relationship so you can search and then talk to people. And that combination on societal change of digitization, telehealth, being able to search on your own, and then having a trusted healer, someone you can call, talk to, and then decide what's the best type of care regimen for you is very important today. And that's what we highlight in the book.
Yeah, fantastic. I mean, you mentioned a really key point there. I think it's all about the autonomy that people take on and responsibility almost of their own health, and being able to kind of utilize the different changes and innovations within healthcare in order to be able to not have to rely on going into the hospital whenever they feel slightly unwell. But then it's also taking that to the right limit where they're not misdiagnosing themselves because they're not the experts. So you're right in saying that it does really come to quite a sort of crossroads where you do need to have that continuous relationship through these trusted healers. One thing I kind of wanted to touch on as well is, in terms of these trusted healers, obviously we're talking about, GPs and physicians that, you have a continual relationship with and get to know you and your medical history very well. Do you think that now and going forward, you could look at trusted healers in the form of technology as well, and being able to rely on specific medical devices that you can put into your daily routine in terms of analysis or anything that might happen, so that they can become that trusted healer as part of your crew?
You're asking me a terrific question. And as you know, from reading the book and looking at my background, I had responsibility to roll out Watson technology, which is the artificial technology that IBM has. And many people remember it from Watson playing Jeopardy. And then around the world, people became familiar with what is today called artificial intelligence. And oftentimes people would say to me that the relationship with the doctor is going to be taken over by some kind of device. And I will tell you that that's not, I do not believe the case. I didn't believe that when I rolled out technology, and I don't believe it today. And I'll tell you why. First of all, the different devices, they are enablement devices. They might help you read different metrics faster, quicker, more responsibility, accountability to it. They may give you some insights. But what it can't do right now is they can't look into your eyes. A cancer patient's eyes usually get a little deeper, and they can't determine the pigmentation in your skin to determine if you're a little jaundiced and be able to do that. They might be able, but the capabilities to do that are kind of far from where they are, because it leaves out the compassion. It leaves out that relationship when you're in that situation where a doctor or a nurse or someone else, you see our bodies are very complicated. They're very complicated. And to try and think that we're going to have some kind of a technical device that's going to handle all of those in the most difficult situation. And all of us react differently to different medications. And so it does require that trained professional, that person to be able to recognize that brings science together with that level of compassion to be able to bring you the right kind of care. So yes, I think technology is a huge advantage. It will help us. It will start to bring the whole idea of being healthy closer to us and to our home. But let us not forget how important these primary care docs are and these specialty care docs are, and we should engage with them. I fear that if we leave them out, we will complicate matters for ourselves to proportions that will not be good.
Yeah, absolutely. And you mentioned there a bit about the, obviously our bodies are very complicated as well. And there's, lots of stuff that we can rely on, both through technology and through these sort of key trusted healers and physicians that are going to be able to benefit our bodies. But I know in the book you talk about the mental health aspect as well. Can you go into that in just a little bit more detail about, how the mental health, I suppose, kind of awareness and change is happening?
Yes, and especially right now with COVID, there are more mental health appointments on the rise than any other type of appointment right now, both tele and in person. And rightfully so. We're all struggling globally with the right way to do that. And as you and I speak, there's probably a second wave or another turn of the crank, if you will, as weather changes and people get COVID fatigue and they maybe don't do all the things that they should do. So definitely mental and behavioral health aspects. We've worked hard to change certain things. For instance, the idea now that electronic medical records will allow you to contain mental and behavioral health information and have it be codified, not necessarily in a free form in the medical record, but actually be able to track it and referring out and understanding the role that mental and behavioral specialists can play in helping you do that. And then also making sure that the insurance products and the way that we look at care around the world, that people understand that it falls underneath the umbrella. So Patrick and I, we were on the Dr. Oz show. We traveled the world talking about the different aspects on mental and behavioral health. We use kind of catchphrases like check up from the neck up, which people like. We talk to people about knowing your rights, about being able to do that. And then we talk about how important it is to talk to individuals, family members about some of these issues, because oftentimes someone that has a mental or behavioral, if it presents itself in a way, it's usually a family member that sees that. And how do you have that conversation, a loving way, and then putting up that mirror that says we should go see someone, because often it goes so far along a path that the person doesn't recognize their behaviors, but it's a family member that does. And I can tell you, as I've had this conversation in different audiences, et cetera, usually someone will start to cry. And right now, probably one of your listeners may start to cry. And the reason is because they're recognizing there's someone that has an alcohol problem. There's someone that has a drug problem. There's someone that has a mental or behavioral health problem, and they don't know what to do. And that's where sometimes it's us as individuals that need to be that trusted healer for a family member when they need us most.
Yeah, fantastic. I mean, the term trusted healer is just applied to so many different areas, and it's such a sort of perfect way of I suppose depicting people's own responsibilities for themselves and also for others, and then also to be able to rely on professionals as well, of course. I mean, we're nearly out of time, which I can't believe. But one question I really wanted to ask you was, when you were researching the book, obviously, throughout your career, but when you were thinking about what to write down and kind of researching each point in a little bit more detail, was there anything that you came across that really kind of surprised you in terms of statistics, or just in terms of the kind of healthcare economy globally that you weren't really anticipating?
Yeah, and it's this small island that you're going to know about, which is just off your coast, the Isle of Jersey, where I used to ask my team that when I traveled around to take me someplace to see something that would surprise me, just like the question you're asking me. So one day when we were actually over in London, we boarded a plane and we flew into the Isle of Jersey. And Joe Dickerson met us there. He was from the Isle of Jersey. They had created a program called Call and Check, where they had enabled the postal service workers to not only deliver the mail, but to ask some questions and check on the people. Now, you might think that idea might work in a small Isle of Jersey where your population is low. And you might also say, well, people aren't going to want someone kind of putting their nose in their business. because you would ask questions like, are you okay? Are your rugs tapped down? Are you up to date on your medications? There's no abuse, is there? They were trained to ask those kind of questions. And as you can imagine, it didn't take long before people would look for their postal worker to come, and they loved having that conversation. Well, to fast forward, now in England, you all are starting to deploy call and check. And Joe has been recognized in England as one of the foremost leaders. And actually, Dr. Kingsland is an advisor to that group. But here you have the small Isle of Jersey that realizes they want to create that relationship, that trusted healer relationship. And maybe, just maybe, if you ask those people, their trusted healer is maybe the postal worker. But the idea to have civil servants and people like that and EMT. And as a matter of fact, in the UK, you all have used the fire department and EMT to distribute food and to serve as an active contributor to your society. So you can see how these ideas, that's one small idea that I believe is really finding a home in today's world of creating that kind of relationship. And it came from the Isle of Jersey and Joe. And what a wonderful man he is, what a wonderful gift they've given us. And it's being deployed regularly. And it fits exactly what Jeremy Hunt had a role for the GP, and people like Dr. Kingsland that you also respect say, hey, this is a pretty good idea.
Yeah, fantastic. Wow. I mean, I wasn't expecting him to be a postal worker or at the Isle of Jersey, but there you go. It's fantastic. Well, look, Dan, I mean, unfortunately, we are out of time. I mean, potentially we'll be able to get you on again in the future and kind of talk about things in a lot more detail, because I know that we've only really scratched the surface. But I mean, the book is out now. So if people want to kind of, find it for themselves and read the full story, what's the best way for them to be able to do that?
Yeah, trusted healers. And Patrick Kennedy says you'll never look at your healthcare the same way again, which is definitely true. And a conservative guide for your own personal healthcare. And these stories that you and I talked about are captured in there. So it's a good read. Amazon is great. Any place you get your books, you can ask for it. Trusted Healers, my name. And my co-author, Bud Ramey, who did a terrific job interviewing many of these people as well. But I think your listeners in the UK will have a smile on their face, because so many of the wonderful innovations that are coming from your great country are captured in the book through leaders like Dr. Kingsland and Jeremy Hunt, and even in an outreach to the Isle of Jersey that you share with France. So just wonderful innovations. And I hope that you'll all continue to bless the rest of the world with the innovations that you all are working on.
Perfect. Well, look, thank you so much for taking the time to chat with me. It's been really, really interesting, and I look forward to staying in touch and reading some more of the book.
Yeah, please do. Thank you.
Perfect. Thanks, Dan. Speak soon.
Cheers.
So that's it for us this week then, guys. Thanks very much to Dan for taking the time out of his busy schedule and slotting us in amongst all of the other media that he's doing at the moment. Really good to hear from him. Really great insight and kind of perfect timing, really, in terms of everything that's going on in the world, and giving people a little bit more insight into how they can take a bit more accountability of their own healthcare and empower themselves to I suppose, put a bit more focus on the decision making around healthcare and all the tools that are available to you, which is so prevalent now that there's new technologies coming out all the time. And I hope you guys really enjoyed that conversation, as I did too. If you did enjoy it and you want to get a copy of Dan's book, then we've put a couple of the links to his website, Everyone Matters, and the Amazon store for the book as well on the summary of this podcast. Feel free to get in touch with his media team as well, which you can do so through the website. But he'll be doing lots more press over the next couple of months, I'm sure. So it'd be great to kind of see how the conversation evolves. So until next week, guys, keep safe, and I'll see you then.
Spilling the Beans Digital Health Podcast is aimed at members of the digital health community globally, with guests from the United Kingdom, Australia, and the United States. The podcast is available through all major podcast distributors, as well as on YouTube. The show is sponsored by Woodrow Mercer Technology and Woodrow Mercer Digital Health.